Good evening again. Welcome back to another video. We're going to be doing reading another installment from the Empath's Survival Guide by Judith Orloff MD. I believe this is the 5th video that I will be doing. And if you want to follow along from the beginning, all of those videos are obviously up on my YouTube page or my YouTube channel in order. So as I was talking to you about this, I lost my place, but we started on chapter 2 last night, which is titled Empaths, Emotions, and Health, How to Stop Absorbing Other People's Distress. Okay, so we talked about the way that mainstream medicine really limits the empaths. When an empath goes to the doctor and they're experiencing things that are also connected to the soul, and how modern day medicine, including, therapy, psychotherapy, counseling, should be, they should take into account more the soul aspect of it also, and if you are empathic. And that's where we left off. So the second part of this particular topic, which is in chapter 2, is entitled, I wanted to share somebody with you guys really quick that I think you guys will love. This is my tortoise. This is Ellie. She's one of the few animals that I have here at home. She's about 7 years old. She's a Herman's tortoise. And she's the sweetest little thing. She wants me to put her down. She was on my bed. But she's the sweetest little thing. If you guys want to see more of her, she likes to chill with me. It took a long time for her to recognize me and to come when I call her. Whoopsies. We have a little bond, and she's the sweetest little gal. And she's a tortoise. I hate when people mistake it and call her a turtle, because there are tons of differences, but this is my little girl. She's so sweet. You won't hear her in the background because she's quiet, but I wanted to share her with you. If you want to see more of her, tell me. All right, so back to the subject at hand. Optimizing your health. Are you a physical or an emotional empath? My hair's bugging me. Okay. It is vital for empaths to take a conscious approach to their health. The first step to optimizing your energy level is to identify whether you are a physical or an emotional empath, or even both. Knowing this will help you to understand how your sensitivities function so that you can build stamina and protect yourself from getting depleted. Physical empaths feel other people's symptoms in their own bodies. For instance, a friend complains of a stomachache and suddenly an empath's stomach starts hurting too. Or a coworker has a migraine and an empath's head starts throbbing too. The upside of being a physical empath is that they can absorb other people's experience of well-being. One of my patients told me that when she takes a yoga class, her empath spouse feels the relaxation in his body as well, even though he's in another part of town. He receives the benefits of her yoga practice as well. How cool is that? Emotional empaths mainly pick up other people's emotions. They can sit beside a depressed person while watching a comedy and walk out of the movie theater feeling depressed. How? The other person's energy field overlaps with the empath's field during the film. The nearer the empath is to someone, the more they will be influenced by the person's emotions and symptoms. The problem is that emotional empaths often have no clue which emotions belong to them and which belong to someone else. They may get thrown off by others' feelings without realizing it or knowing how to recenter themselves. As one patient told me, it takes me a full day to recuperate from being around an extremely negative or angry person. But there are solutions. A big aha moment for another patient, Terry, was realizing that she'd been absorbing her mother's anxiety since childhood. Empaths have big hearts and often unconsciously take on their loved ones' emotions. Once Terry became aware of this dynamic, however, I could teach her to set boundaries. I had her visualize cutting an energetic cord between her mother's anxiety and herself. This allowed Terry to maintain a healthy boundary while still remaining a caring daughter to her mother. Both physical and emotional empaths make good medical intuitives when their abilities are trained. They can diagnose disease in others by empathically sensing other people's symptoms. To protect their own health, however, they must also become skilled at releasing what they pick up. I imagine that's difficult to not just practice, but also, I don't know, I feel like that would be really tough to be empathic and a doctor, not just because you may feel their emotions or their feelings while they're there, but also because you can't just say, oh, that's too bad for them and wish them well and move on. You tend to like hold it with you like it's your own. At least that's what I do. I don't know. I can only speak for me, but yeah. Okay. The goal for all empaths is to lead more comfortable lives by learning how to stop soaking up negative energy. We may instinctively want to take away another's pain, but that's not healthy for us. I've learned to be present for my patients and my workshop participants without shouldering their discomfort. Since I frequently give seminars and speak in front of hundreds of people at a time, it's essential that I ground and protect myself. This allows me to do the teaching I love and not get worn out by excessive stimulation. Throughout this book, I'll continue to share effective tools that I use in my own life to be a balanced empath. And then next we're going to be coming up on what we call a physical and emotional empath self-assessment. So just like the checklist from one of my previous videos, we'll go over certain things, and then depending on how many boxes you check depends on what level you are, I guess, as an empath. Okay. To stay in good health, it's important to determine whether you're a physical or an emotional empath. Like me, you might even be both. Knowing more about which type of empath you are will allow you to take clear steps towards self-care. Here are 2 self-assessments to determine what type of empath you are. Okay, self-assessment. Am I a physical or emotional empath? I'm sorry about the lighting. This was kind of the best I could do right now. Am I a physical empath? So here's, ask yourself the following questions. Have I ever sat next to someone in pain and started to feel pain too? Do I get physically ill in crowds? Have I been called a hypochondriac but know my symptoms are real? Do I react to other people's stress by developing a physical symptom in my own body? Do I get energized by some people and depleted by others? Do I frequently go to doctors without getting treatments that help? Am I chronically fatigued, or do I have mysterious and unexplained ailments? Do I often feel exhausted by crowds, preferring to stay home? Is my body sensitive to sugar, alcohol, and processed foods? Now here is the Am I an emotional empath self-assessment. Ask yourself the following questions. Do I pick up other people's emotions, such as anxiety, anger, or frustration? Do I get an emotional hangover after an argument or a conflict? Do I feel depressed or anxious in crowds? Do I want to fix people and take away their stress? Can I intuit other people's feelings even when they are unexpressed? Is it hard to distinguish other people's emotions from my own? Do I care so much about others that I neglect my own needs? Do I overeat to cope with difficult people or emotional stress? Do I experience mood swings from sugar, carbohydrates, or other specific foods? Here's how to interpret the self-assessments. 1 to 2 yeses in a category indicate that you're partially that type of empath. 3 to 4 yeses indicate that you are moderately that type, so either a physical or emotional. That type of empath. 5 or more yeses indicate that you're definitely that type of empath. Discovering that you are a physical or emotional empath, or both, is important knowledge about yourself and how to cope with the world. You are not crazy or a hypochondriac. You are a sensitive person with a gift that you must develop and successfully manage. empathic illnesses. So this is, we're going to talk about some common illnesses for empathic people. I have coined the term empathic illness to mean illnesses in which someone manifests symptoms that are not their own. Yes, it's possible to catch these from other people. Such symptoms feel like they're yours, but they are not. A confusing predicament. For instance, one of my patients, Alicia, actually felt her asthmatic sister's shortness of breath in her own body, even though she didn't have the condition. Another patient, Brian, was so connected to his wife that his hand would hurt in sympathy with flare-ups in her arthritis. Some illnesses are totally empathic. More often, though, picking up other people's dis-ease will aggravate symptoms an empath already has. In severe cases, empathic illnesses can leave people chronically ill, housebound, and paralyzed by social anxiety. Empaths are prone to social anxiety because they're overwhelmed by the multiple spoken and unspoken signals people give off in groups. Empaths are also sensitive to rejection. These individuals become so exhausted and burned out from feeling the world's stress that they can't function. Again, because conventional medicine does not believe in the existence of the body's subtle energy system, most doctors have no context for understanding what's going on with empaths or how to relieve their suffering. This is true. I've been in the medical field for 21 years, and I've worked with some amazing, amazing doctors, even DOs, which are doctors that are more into helping you heal using alternative medicine. So it's not that they won't prescribe a medication, but they are more inclined to try physical therapy, vitamin or herbal supplements, things like that. But they work in a medical setting, so they can still do all of that medical stuff. It's like they kind of mesh it in. And even then, I can't say that I ever, at least to my knowledge, worked with a doctor that any of their patients gave the sense that that was also something that was part of helping the patient or acknowledging. Okay. I lost my place now. Oh, okay. Most doctors have no context for understanding what's going on with empaths or how to relieve their suffering. I already read that. Many patients come to me with these common empathic-related illnesses: adrenal fatigue, autoimmune diseases such as Hashimoto's thyroiditis and inflammatory bowel disease, agoraphobia, or the fear of going outside, phobias, for example, of crowds, driving, or large stadium events, chronic depression, chronic fatigue, fibromyalgia, pain, panic attacks, and social anxiety. Over 20 years ago, when I first started treating empaths in my psychotherapy practice, I didn't know how to adequately help them with their symptoms. I was just learning to cope with being an empath myself. However, when I took a careful history, I found that most of these patients were in close contact with a loved one or coworker in distress and were unknowingly absorbing that person's emotions and symptoms. I could relate because I did this too. Other empaths responded strongly to changes in the natural world. I had one patient whose back pain grew worse during thunderstorms. Some experienced seasonal affective disorder, or SAD, a depression that occurs in the winter when days are shorter and darker. Also, many empaths felt more restless and anxious on a full moon, while feeling calm on a new moon. Realizing the exquisite sensitivities of empaths and their inability to modulate them has significantly changed how I treat these patients. My job has become about teaching them grounding techniques and how to set healthy boundaries to protect themselves. The correct treatments for empathic illnesses is to train these sensitive people to stop absorbing the energy and stress of others, rather than medicating their symptoms. Then they can stop fighting exhaustion and overwhelm and experience vibrant health. And then there's just a little saying here, I'll read it, or a little quote. The people who are sensitive in life may suffer much more than those who are insensitive. But if they understand and go beyond their suffering, they will discover extraordinary things. And the person who wrote this is named Jiddu Krishnamurti. I think that's how you say it. Okay, so we'll read a little bit more. Empaths and medication. I think we touched on this in the last video. Many physicians go straight to antidepressants and anti-anxiety medications when treating empaths, but I try not to use them initially with such sensitive souls. Sometimes my patients just need to be kinder to themselves and make small adjustments to ease their lives. For instance, Jane came to me with intense anxiety when she drove on the Los Angeles freeways. The multiple lanes of cars and the huge trucks whizzing by in both directions overwhelmed her and made her lightheaded. Many empaths, including myself, have this aversion to freeways. The high-speed traffic and upset drivers are just too much for some of us to process. I have not driven on the freeway for years. Although Jane had practiced deep breathing exercises before getting into the car and took shorter freeway trips to get used to driving, these strategies were not sufficient. Her physician suggested anti-anxiety meds, but she wasn't comfortable taking them. I presented Jane with a simple alternative. Instead of continuing to make herself crazy trying to get over her driving anxiety, she could give herself permission to avoid freeways when possible and take some wonderful side streets throughout the city, the way I do. Jane felt tremendous relief with this solution. She simply allowed for more travel time. I also urged her to stop pressuring herself to be like other people, a mistake many sensitive people make. I think that's something all people do. This poor woman was driving herself crazy because she felt like, she should be able to drive on the freeway and was beating herself up. And I think that's something a lot of us do. But yeah, when you're empathic, it's like, I think tenfold. Empaths often have special needs that must be respected, and these needs are okay. We're not failing or copping out by finding ways to be kind to ourselves. The softer and easier solution to a problem can be a merciful way to resolve anxiety without having to turn to medication. However, once some empaths have been chronically depleted by trauma or stress, they may well require medication for depression and anxiety to rebalance their biochemistry. I prescribe such medication mainly for the short term. I find it interesting that many empaths require a much lower dose than other people do to get a positive effect. For instance, a sliver of an antidepressant can work wonders for my highly sensitive patients. A mainstream physician might write this off as a placebo response, but I disagree. Empaths are just more sensitive to everything, including medication. We often can't tolerate the usual doses that conventional medicine deems effective. If you're an empath who needs medication, I suggest working with an integrative healthcare practitioner who understands subtle energy and can find the best dosage for your body. I'm also fascinated by new research on how pain medications can inhibit empathy. Ohio State University researchers recently found when participants who took Tylenol or acetaminophen learned about the mishaps of others, they experienced less dismay than those who didn't take the drug. Knowing that Tylenol decreases empathy is important since 52 million Americans take a substance containing it every week. We'll read the last one. Empaths and adrenal fatigue. Adrenal fatigue is a common health issue for empaths. Some of my patients come in with this syndrome, which is a collection of symptoms, including exhaustion, body aches and pains, anxiety, trouble thinking clearly, and insomnia. What is the cause? One theory is that the adrenal glands can't keep up with incoming stress, so hormones such as cortisol, which normally are energizing, becomes depleted. Because empaths also absorb other people's symptoms, this adds to their stress levels and leaves them vulnerable to adrenal fatigue. What follows are some solutions for treating adrenal fatigue. Using them can help turn around symptoms and restore energy. But remember, these solutions aren't a one-time fix. Overcoming adrenal fatigue requires basic lifestyle and diet changes so that empaths can effectively manage their energy over the long term. Along with the following tips, I will discuss a range of strategies throughout this book. We'll go over the strategies here. Protection strategy, tips to relieve adrenal fatigue. Eat a whole food diet. Avoid processed and junk foods, gluten, sugar, and white flour. And you'll learn more about diet in Chapter 3. Add Himalayan red salt to your diet. Eliminate low-quality salts. Always check with your physician about your salt intake if your blood pressure is high. Exercise. Practice gentle exercise and stretching to build up stamina and energy. Meditate. Meditation increases endorphins, which are natural painkillers, and reduces stress hormones. Get a blood test to measure your cortisol level. If your cortisol level is low, consider temporary natural cortisol replacements per your physician's recommendations. Rest a lot. Sleep is restorative and healing. Take B vitamins daily. Take 2,000 to 5,000 milligrams of vitamin C daily in the acute phase. Consider IV vitamin C drips, 10,000 to 25,000 milligrams. This will increase your energy and immunity and support adrenal health. Holistic physicians often offer this treatment. I do this when I'm coming down with a cold to strengthen my immune system. Eliminate the energy vampires in your life. Try to rid yourself of toxic people, or at least set clear limits and boundaries so they don't sap you. More about this on Chapter 5. In addition, be kind to yourself and stay positive. Focus on wellness, not illness. Do not beat yourself up with negative thoughts such as, I will never feel better, or I am weak and sick. No matter what's happening in your life, you will always have control of your attitude. To relieve adrenal fatigue, you can reduce inner stress by cultivating self-compassion. So we'll stop right there, and we're going to be talking about self-protection for empaths. And there's a lot of strategies in here that she shares. That's probably what will be our entire next video, because yeah, we're going to delve a little deeper into the exercises and some specifics. So hopefully you got something from this little nightly nugget. I like to read it before I go to bed. I'm always in my jammies. I'm going to grab my tortoise. She went behind the pillows. There she is. She likes to go behind my pillows, and we're going to say goodnight. Good night. Good night, guys.